This is going to be an economist's view. I insist on economist and economist view. Economics is not that far along to think about AI and the application of AI to health. And I'm just an economist, so bear with me. You have much more knowledge than I do about all those topics, and please forgive me for any mistake I make. I just want to basically share some thought and give you some framework to think about it. So we have had lots of predictive algorithms. They have made a lot of progress. Netflix is going to advise you on give you a recommendation that's going to help you write software. Doctors may use AI for triaging, forecasting sales for firms. VCs try to guess what the successful startups are going to be, and so on and so forth. And of course, try to predict the properties of drugs in your case. There have been a couple of studies. So for example, here is an MIT study which studied, it's called AI Predict Fix, which basically looks at the maintenance of heavy duty trucks and try to predict breakdowns. And they've shown that AI can actually achieve roughly 85% of the cost savings. So that's quite a lot. I mean, I don't have to convince you, it's kind of obvious. There are, of course, limits to predictive algorithms. When you have few data, situations are new, unfamiliar, of course, you cannot feed as well the AI. And also when causality is very important, where you really want to know how it works, how the drug works, or how the policy will work, so as to, for example, understand the side effects, then it's a little bit more difficult and it's more limited. Of course, now you also have generative AI. I'm not going to discuss that. So 3 parts. First, I will be talking about how AI changes labor and R&D. Then perhaps something newer for you is the future of the AI value chain, and then I'll talk about AI and health, which is of course very familiar to you. So how does AI change labor and R&D? There's an emerging literature which tries to understand the answer to 3 related questions, very closely related questions. The first is the death of theory. If we have enough data, do we need theory in the first place? Of course, the opposite view is that domain knowledge or expertise is still going to be important. And if we listened to Alain Aspect this morning, and it seems like the theory is still important. At least that's what I want to believe anyway, because I'm a theorist. But even so, I do empirical work as well. Second question: will data-driven prediction foster competition? Of course, we economists, we love competition. And the question is whether access to AI will actually help create a level playing field. So, the laggards are going to be able to catch up with big firms. And until a year or 2 ago, I was thinking, Google search, for example, has been a monopolist for almost 20 years. They have so many data and knowledge that you cannot catch up. They make a huge amount of money on search. But now, you look at Search GPT, you look at Claude and so on, you say, maybe Google search is threatened by the new technology, or Booking, for example, if you think Booking.com is going to be threatened. Now, the opposite view is basically that algorithms are a form of skill-biased technological change. So actually, it's going to help those firms which already have those skills. And very lately, there's a question more at the micro level about whether AI will be a complement or a substitute to human labor. And we are going to look at 2 papers very quickly. In what one AI will be a substitute, and the other it will be a complement. So this paper from Stanford is basically looking at generative AI used for conversational guidance. So basically, you're on the phone, you answer questions of customers, and you're looking to help them in some way. So you respond to their queries. And the study there, with the introduction, I'm not going to give you the details of the study, but basically, the study, it shows that you get a productivity increase in terms of the quality of response, the number of good response, and so on. which is 14%, fine. Now, the interesting part there is that those who benefit from the improved productivity are actually the lower skill workers, so the ones who actually don't know very much, are inexperienced. There is almost no progress for those who are very high skilled, very experienced workers. So in that case, basically, AI substitute for knowledge in a sense. It allows low skilled workers to catch up. And what's interesting is actually they learn. It's not just that they read the answer which is suggested by AI, but they learn. So when there is a software, when there's some breakdown, they keep giving better answers. Now, the question, of course, is that at some point we will have to pay those high-skilled workers. Someone has to pay for them. It's the same thing in radiology. We know that the quality of radiologists is very heterogeneous. And if you have AI programs which embody basically the knowledge of the best radiologists, then you will have to pay those radiologists at some point in order to produce, to learn the skills and produce this knowledge. Now, this other paper is a graduate student at Berkeley, shows that AI and labor may be complements. So that's the opposite view. So, interestingly for you, it's pharmaceutical innovation. And they look at genome-wide association studies, GWAS. There are many conducted, but not by industry, by academics. They look at, of course, the correlation between the genomes and the disease. And they try to identify some correlation in some way, okay? And that's very useful, and you see actually that the amount of publication and R&D actually grows up when you have such a publication by academics. Now, what they do, of course, those studies, is to basically provide some promising leads, but they generate a lot of false positives as well. So it's not going to give you the answer. It's going to basically restrict the set of combination you should be looking for. And what they show in that work, what he shows in that work, is that knowledge is still very important, because again, with all those false positives, you still need to use your knowledge to narrow down the set of possible drugs. And also that actually specialized firms actually benefit more from these studies than more generalist firms, because they know better what to rule out. So that's a case of complementarity between AI and domain knowledge. And in a sense, the best firms may actually benefit from efforts funded by the government. Now, what is my view on that? Well, it's very hard to tell. All those studies are extremely specific to a moment of time and a particular AI study, right? And sometimes you'll find complements, sometimes you'll find substitutes, sometimes you'll find an increase in competition, sometimes you'll find a decrease in competition. Okay, so I'm not sure that we economists, because that requires a lot of work to do it properly, I'm not sure that we economists can have general conclusions about this substitutability between AI and labor, which of course is a highly political issue. So do we have an answer? My view is no. We have some insights, that's all we have. So the second item in my talk will be about the future of the AI value chain. So let me talk about the old economy. The old economy is Google, Facebook, Apple, and so on. You all know them. And they organize the biggest market caps in the world are two-sided platforms, like a search engine, e-commerce, app stores, social networks, and so on. And they are the biggest firms in the world nowadays. Now, you may ask yourself, how do they make money? This is, of course, a highly simplified Mickey Mouse view of the industry. But if you don't understand the simplest thing, then it's very hard to understand the more complex ones. So basically, you have a platform in the middle, which basically provide business users access to consumers, to us. here, consumers single home, so that means they basically use a single platform. So you use your iPhone or you use Google search. And then some people want to get in touch with you. They may be the merchants on Amazon, for example. They may be app developers. There may be advertisers who want to reach you. And there may be in-house or third party. So, of course, Amazon, Google, and so on have their own operation. They operate market, but they also compete in those markets. And on the business side, the platform can make money in two ways. The first, of course, is through their in-house operation. The second is by charging fees to third-party apps or merchants. Okay, so Google is going to make $175 billion per year on advertising. Amazon is going to, or the App Store are going to make a huge amount of money by taking their cut on whatever is sold in their stores. For example, they may take 30% like the App Stores. Okay? So you can have three ways of making money in this simplified world, which is a world of Amazon, Apple, Booking, and so on. More and more NVIDIA, by the way. I mean, all the first ones have really been subject to a very intense antitrust scrutiny in the US, in Europe, everywhere. You see every time in a newspaper some kind of lawsuit against those firms. Soon it's going to be NVIDIA, of course, not necessarily the chips, but CUDA, of course, the software, which is a bottleneck. And we'll see that with OpenAI, we'll see that with many other platforms. So you must be aware of what's going to happen, right? So there's a lot of platform regulation in practice where you have a dominant platform which basically controls business users' access to customers. And you have lots of regulation nowadays. This is for Europe, but you could say the same for the US, for example. I'm not going to talk about the regulation on the consumer side. On the consumer side, you have a bunch of regulation like GDPR, the Digital Service Act, the AI Act, and so on, which basically take care of content curation, the behavioral manipulation of consumers or privacy. That I'm not going to talk about. I'm going to talk a little bit about the DMA, the Digital Market Act, which is concerned with two things. The first is contestability, just to make sure that someone who wants to enter the search engine market or the e-commerce market can actually enter if this firm is at least as efficient as Google or Amazon. So that's the contestability issue. And then there is another issue is whether the business users, also third-party business users, again, advertiser apps or merchants, actually have a fair access and a fair compensation. It's not quite the same thing. There's a lot of allegation that actually the platforms don't give an equal access to third-party apps or merchants. Fair compensation may happen even for a pure platform like Airbnb or Booking, which do not operate in the market they organize, but they may be asking too much money. There are lots of lawsuits about, for example, the app stores of Google and Apple when they are 30% cut. Okay, so example of protection of the core segment. You have all heard about the Google search case. The idea is that Google is actually depriving the entrants of economies of scale. Search is it's like data in a sense. It's very very prone to economies of scale. And Google pays for default, not for exclusivity, for defaults search agreement, 26 billion, 20 billion of them to Apple only. Now, DMA is also trying to boost contestability, so basically the possibility of entry into the core segment by facilitating multi-homing. Multi-homing is basically when you connect to multiple platforms, so business users. So, for example, Uber and Lyft drivers can connect to both platforms, Uber and Lyft. There's no exclusivity. That's an example of multi-homing. So DMA is trying to facilitate multi-homing. It mandates interoperability. That's mainly for Facebook. And more controversially, it promotes data silos. So data silo means that Googles cannot combine data from various services. And of course, this is to improve competition, but that's also destroying some value along the way. Now, on the business side, the equity concerns. So there are lots of allegations of self-preferencing. Basically, you downlist your competitors. You put at the top of the list your own services. Google Shopping is probably the most famous of them. Amazon as well, and so on. But you also have example of excessive fees. So the 30% I was mentioning, there are lawsuits against Apple by Spotify, Epic Games, and so on. And you also have this way of promoting high merchant fees, which is called the most favored nation clause. I prefer the best price guarantee, which basically bookings come to you and says, look, you'll find all the hotels. You want to be in this neighborhood of Paris, you'll find all the hotels on Booking. You'll get a great service, that's true. And on top of that, you'll get the lowest price, because the hotels have to sign that to guarantee that they will basically charge the lowest price to Booking customers. That sounds wonderful, except that it's really a way of maintaining very high fees for merchants. It's actually one of the rare cases where a business can tax its rivals. I could explain to you. In any case, our president was at the time finance minister, basically outlawed those. This prohibition actually was bypassed. I could go on and on this topic, but it's actually very interesting. But the basic idea of this prohibition is really to limit excessive fees. Okay. Now, what about this? Okay, this is an HBS case study. Claire knows Ariel pretty well. And it's about a company that you probably know much better than I do, but AI Doc, which at the start was specialized in hemorrhages, brain bleeds, detection and triaging. And basically, the customers, the hospitals, for example, the healthcare system, were asking for more. We are not interested only in brain bleeds, but we are interested also in products in cardiology or neurology and so on. So we want to have a whole set of products, and it's moving at this stage to becoming a platform. I mean, that looks very much like what we had before, right? Where basically iDoc provides its own services. So in that case, it's brain bleeds, but also is providing products or services from other providers, and basically acts as an overall care coordinator. Now, of course, this company will be facing the same thing. Actually, it's actually one of the largest global medical image databases. I presume it does the same thing as Google does, which is basically to get all the data from the apps, including third-party apps. But it's going to be a gatekeeper, just like Google and Amazon and so on. There's something which is very interesting issue, which is the issue of liability. In 1996 in the US, the Congress basically decided to exempt platforms like Amazon from liability. So liability respect to curation of content, but also, you know, if Amazon sells something which from a third party which is not working, then the liability is not with Amazon. And the idea was to develop the internet at the time. But of course, nowadays it becomes more complex, right? So you sell third-party services. Are you liable for this kind of if they are defective, right? And that's very important for those platforms, because that's going to condition the development of such platforms. Okay. And notice that there is self-preferencing, because it's very explicit that AI Doc actually takes partners which do not compete with its own operations. So for the moment, it's fine. At some point, it might not be fine with regulators. So the million-dollar question is, who is going to appropriate the value in the new world? Who will be the new gatekeepers? And by the way, I think we economists and more generally social scientists are behind I think we should do much more social science fiction. We like to work with, formalize what exists, do empirical work on what exists, but at some point you also have to try to think about what's going to happen, and that seems very important, especially when technological progress is very fast. It might be the data owners. We heard data as a new gold. So there, in healthcare, for example, that will be the individuals, the hospitals. It might be large language models, and then there is a debate about that, and probably you know much more than I do about this, but there is a view that LLMs have become a commodity. Basically, the science has been known for a long time. It's in the public domain. There's been writing by Google basically saying, no, I mean, there's no protection, no patent protection, for example, but no, not much. At the same time, we also know that the weights which are involved in neural networks are an art more than a science, and they are proprietary more or less. I mean, there are some which are transparent, but more or less it's proprietary. So those weights might create monopoly position, perhaps deserved, of course, because there's an investment which has been made. Now, what is sure is that the complementary assets will be key. So those complementary assets will be data, which require some investment that was mentioned this morning already, because you have to collect, curate, update, and so on. That's very important, so that's expensive. You have to train the models, I already mentioned that. But also you need the entire compute environment, including the cloud and software, hardware, and so on. So, there are lots of potential bottlenecks in this. So, and that's very familiar. We have been knowing for a long time from telecom industry, from internet industry, and so on, that the bottlenecks are not always where you will anticipate they will be. Okay, and we cannot know. Now, if there is such a bottleneck, what will the regulators do? So they can do like DMA, which is, okay, there is a bottleneck, everybody should have access to those bottlenecks at a fair, reasonable, and non-discriminatory price, friend. That's when you don't know what to do. If you say you don't know what to do, you just say, let's have access at friend. The lawyers love that, but it's a big issue. So we'll see, but it's very clear that, in particular, the data providers are very concerned about receiving their fair share. So, content providers, you have all heard about the musicians, the media company, who are worried about the displacement of their creative workers. And they've noticed that actually copyright is no longer protecting the creative work nowadays. Of course, copyright, there are lots of papers by economists and lawyers basically explaining to you why copyright doesn't work in the age of AI. So that raises the issue of, if you want to have AI, so you need the input, how do you protect the creation? And, to some extent, it's a complex issue because we know that AI brings some value, the creator brings some value, and, how do you split the value between those two, for example? But it's even more complicated than usual because you may not even know what content was used. So you see the outcome of the AI and you don't know where the content comes from. That's difficult. And, what is the contribution of the machine? What is the contribution of the various content supplier? It's pretty clear that the content of the New York Times may be much more important than the content of the tabloid, right? But how do you reward? It's not like Spotify, streaming. I see Claire's music is actually listened to by millions of people, so I can reward Claire more. Now, there's nothing like that for AI. It's who deserves actually who has made this attractive? We don't know. That's an old question. There's been from years ago discussions about consumers. So consumers, as you all know, when you connect to Google and Amazon, and you get all those wonderful services. Basically, you don't pay for them, okay? And the arrangement is data for service. I mean, the arrangement is also that the business users will pay for that. But it's also, you're also paying in data. So you're paying in cash, in kind, not in cash. And that's one of the reasons why actually we are at what we call the zero lower bound, which is basically the price is equal to zero. You cannot go below zero because otherwise robots will have a great time arbitraging the thing, but basically you're stuck at zero. Now, that may not be the only reason. You could have consumer naivete. So it may be the case that the consumers don't know what the cost might be for them to give their data. It could be data anxieties. You might say, why should I refrain from giving my data given that it's going to be on the web anyway? Because my family, my friends, my colleagues, everyone is going to talk about my health, what I do, my political preferences, and so on. So what the hell? I have nothing to hide. It's already out there. That's called data anxieties. But then that's the current arrangement. Some people have thought about some collective action where we will all get together and say, no, Google, you have to pay us, okay? Nobody has really designed such a big plan to know how to do it. For one thing is that there's some redundancy between data. So, the marginal value of the data may be smaller than the average value, maybe. Once you have enough, that's possible. But, there are some data which are more important to the platform than some others. So, in terms of consumers. So you could have someone in between, but how will this platform in between work? Nobody knows. And that introduces another agency prime, so more bureaucracy. You could have a collective license, but as I mentioned earlier, there's a prime of valuation. How much does the content provider or here the consumer bring to the platform? Nobody knows. Okay? So let me conclude with a few remarks on AI and health. They will be extremely familiar to you, and I apologize for not having more to say, but it's very clear that AI is going to be used for many things. Treatment, identification, personalized treatment, patient autonomy, and reduction of healthcare staff. That's something which is extremely familiar to you. I should not belabor the point. Sometimes, by the way, you may require some training. There's MIT paper basically looking at radiology. I mean, as you know, AI is better than 75% of the radiologists. But that doesn't mean that you don't want to have human intervention. Actually, you may combine the two. Those are not exactly the same knowledge. There is some correlation, but it's not perfect. So in theory, you put AI and you give a radiologist the AI input, then you should do better than just pure AI. That's not what they find. That's not what they find because they notice that AI is not used optimally by the radiologist. So the radiologist may be overconfident in his or her abilities. That's one thing. We're all overconfident, as we all know. We all think that we are better than we are. That's human nature. But also, they don't understand always that the two pieces of information are actually correlated. They are not perfectly correlated, but they are correlated, and they discount that completely. They think of that as being independent variable. Okay, so that's one thing. Then we have heard about this, and you'll hear more about it in the days to come. R&D. So you speed up. You use in silico trials to speed up, and of course, there's Dassault Systèmes, of course, is working a lot on that. And you increase the rate in phase 1 and phase 2 clinical trials. But you can also choose subject for trials. You can repurpose molecules and so on and so forth. So those are all familiar to you. Digital twins, of course, you know, where digital twins are basically going to be reducing the cost R&D, accelerating innovation, facilitating coordination and scalability. And of course, they can be used also by regulators like the FDA. So that's very important. And as an economist, I think the main question for us economists will be the regulatory one, as usual, which is, to what extent are we going to accept digital twins? I mean, they are being accepted now, but you know, how far will we go with in silico basically replacing in part the clinical trials, and how do you design the liability and all those things is going to be it's quite an economic question, and you know, that's something which is going to be important. So that brings me actually to my last point, which is a public policy challenge. 5 obstacles for the adoption of AI in in the health space. First, you depends on the country, but you must basically get physicians on board, because they can block. Actually, they are very happy to work with AI when AI is a complement, but when AI becomes a substitute, then they will block things, obviously. We have had precursors where that has happened. Anytime there is something that reduces their power, and of course the demand for the labor, there will be a natural reaction actually to block the new technology. You may say, well, but if it's blocked, you know, basically AI will be used by new players who are going to replace the old one. But I don't see how, in a country like France, for example, basically the new players will replace the existing one. It will be, the political resistance will be too strong. So part of the challenge is, of course, to get doctors on board. Okay. Then there is the authorization, and you know, so far the FDA has been pretty good at approving hundreds of software and AI-based devices. But that's going to raise the issue of what are the standards, right? By the way, there is this issue which is unlike a molecule. A molecule, you know, you approve, the FDA or may approve a molecule, you know, after a clinical trial. Now, with AI, it's going to be different, because you know, the program is evolving over time. And that means that over time it's improving, but basically what's being used in 2026 is not going to be the same as what's being used and was approved in 2024. So that raises issues of basically dynamic updating of approvals. Access to data is crucial, and you know, how do you make sure that parties actually are willing to provide their data, are willing to curate it, are you willing to update it and put it in a form which is consistent with the others, okay? And finally, reimbursement, okay? So, of course, AI, in order to have a market, must have a reimbursement scheme which is consistent with its performance. You know, of course, fee for service is not going to work. Or you have spent a millisecond on solving this issue, so we pay you half a cent. No, that's not going to work this way. And we need to have a reimbursement scheme which is based on performance. And that's, we know from previous experience, that it's not very easy. Okay, because you have to define a counterfactual, what would have been the performance in the absence of this treatment, okay? And liability, which is the last thing which I want to mention, and a little advertising for my colleague Jean-François Bonnefond, who is actually a psychologist at the Toulouse School of Economics, who has written some extremely important work on self-driving cars and the notion of liability and the notion of morality as well. That's going to be a big issue also in your industry, and we need to think about the legal regime. Actually, for self-driving cars, it's still the main obstacle, right? You know, we need to, who is writing the software, with what criteria, with what liabilities. That's the big issue. Okay, so I just wanted to convince you. Again, I have no expertise, very little expertise in your field, but that the economics of platforms is highly relevant. But of course, we need to understand, you know, the new environment better and not just look back at the previous episodes. There's a huge concern about AI. I'm not telling you anything new here, both for the future of work, for privacy, for antitrust, and so on. And they are real, so we economists, and I would say social scientists in general, must be really engaging in social science fiction to anticipate these issues. But you know, the prospects, if we can remove all those barriers, the prospects are going to be superb.